Have you ever wondered what relationship an abnormal blood pressure holds to heart disease? Hello, my name is Valerie Gonzalez. The research I did was on blood pressure and if having an abnormal blood pressure correlates to having cardiovascular disease. I summarized 6 articles and discovered that a little over half of the participants had hypertension or a history of hypertension. Stated by the American Heart Association, a normal blood pressure is 120 over 80 millimeters of mercury, the top number being known as systolic and the bottom diastolic. A high blood pressure is known as hypertension, while a low blood pressure is known as hypotension. Hypertension could be determined by having a systolic number of 120 to 129 millimeters of mercury and a diastolic number of 80 millimeters of mercury. Hypotension can be determined by having a number of 90 millimeters of mercury for systolic and 60 millimeters of mercury for diastolic. After analyzing the articles, many prove that abnormal blood pressure does correlate to cardiovascular disease. In some cases, it resulted in saying patients from experiencing strokes and administer medications for those who needed it. In the article Cardiovascular Disease in Women Who Delivered Preterm Births, an abnormal blood pressure during the pregnancy resulted in them having high blood pressure throughout the pregnancy. Several ways to prevent an abnormal blood pressure include a healthy diet, exercising, and maintaining healthy body mass. For the purpose of the research, I took the blood pressure of 10 volunteers along with their height, weight, age, and pulse. Some of the materials that I used were the stethoscope, blood pressure cuff, disinfecting products, and a weight scale. Using the information gathered to analyze if our community lied within the minimum and maximum range for blood pressure, as well as to determine who had an abnormal blood pressure and who were at risk for cardiovascular disease. To ensure the safety of myself and others, I sanitized all equipment before and after I used them. Some of the volunteers had a high blood pressure because they had previously been active by exercising, and one had just sliced their finger minutes before taking their pressure, resulting with a systolic number of 150 millimeters of mercury, affecting the results. Results also showed that the female participants showed both low and high BMIs due to stress eating and not working out during this pandemic. As shown in graph 4, most male participants had a low BMI compared to the normal range of 23 to 25. Graph 1 showed that the female participants all had a normal resting heart rate that stayed between 60 to 100 beats per minute. Nonetheless, more research is needed to view if there are more underlying factors that may correlate to cardiovascular disease. Some of the resources that I used can be found in the bottom left corner. I would also like to acknowledge Dr. De La Torre, Department of Natural Science at Laredo College, Sabrina Rios, Research Student Mentor at Laredo College, Kathleen Chavez, Research Student Mentor at Laredo College, Dr. Nora Garza, Vice President for Research Development and Title V Project Director, Ms. Agüero Riojas Leaves Project Director, Mrs. Gabriela Solis Cavazos, Undergraduate Research Coordinator, founded by the Hispanic Serving Institute, titled 3 STEM, Articulation and Project titled 3 Leaps. I will answer any of the questions that you may have during this presentation now.